To that, I think all of us here that are part of healthcare Australia are always willing to come and teach and be a part of the institution, be a part of the medical school, be a part of the nursing school, be a part of something here that we go to impact all of this knowledge that we all have, different guys, and come back and I think we all are, some of us are right of retirement and come back here and I would be one of those people that would come back here every month. Because I have 20 years, almost 20 years to like of oncology experience. That's all I've done since I became a nurse practitioner. So I have to come back here and leave, not leave, follow somebody, or be in a program where we can help with cancer treatment, cancer, teaching cancer, this cancer, whatever it is that I can come and be a part of, I'm willing to do that. Thank you.
Thank you, thank you, thank you. And our last speaker, there's so many questions about this
So
issue,
guys,
but reach out to Dr. Nguyen separately, have a side conversation. Urinalysis and how it will save our lives and help with the treatment for many diseases. Next slide. What is urinalysis? Urinalysis, also known as urine test, is a common test that providers use to screen and monitor certain health conditions. It says visual, you look at the urine, chemical and microscopic aspects of your urine testing. It can also include a variety of tests to detect and measure various compounds using a single sample of urine, and most times using a urine detector. Next slide. What does urinalysis detect? Liver disease, kidney disease, diabetes, UTI, which is urinary tract infection. And what do they look? What do you look at when you do urinalysis? Look at volume, odor, color, cells, gas, crystals, and bacteria. Look at pH, protein, urea, glucose, and creatinine. Urinalysis, the normal urinalysis should be colorless, some shade of yellow like orange, light orange, pale yellow, amber, depending on concentration, meaning what have you eaten before you get the urine sample? What medication have you taken before you get the urine sample? Next slide. Cloudy urine does not necessarily mean unhealthy. It could be red blood cells, bacteria. No. It could be, you also can find red blood cells, WBCs, which are white blood cells, bacteria, skin cells, and sperm cells from urine that you need for urinalysis. What affects the color of urine? Like I said, certain medications, supplements, and certain foods. Medications that I know offhand, or some of them would be like people who take allopurinol for gout. You can see that bright yellow or orange color of the urine. So you have to really ask patients, what medications are you on? Or if you see some different color or color that is tempting, what have you eaten today? Like overseas, we say beets, which are red color fruits. I don't know, fruits or vegetables, they will come out very red, which over here we say blood in the urine. Next slide. Oh, stay on it. So, like I said, red tinge blood in the urine can be a sign of UTI, kidney stones, or in rare cases, cancer. Reddish purple can be a sign of lead or mercury poisoning. Polar or tea-colored urine or foul-smelling urine can be a sign of kidney disease. Orange hued urine can be a sign of problems with your liver or bile duct. Next slide. Again, greenish or cloudy pee can be a sign of UTI. I spoke with my boss who said he doesn't call you It doesn't confirm UTI. That's why I said when I first started, a simple urine dipstick can really lead you towards getting a better diagnosis or addressing certain conditions that could get worse if you have not done what you should do. Chemical findings with urinalysis, you look for ketones, which also check for diabetes-related ketoacidosis. Glucose urine test measures the amount of sugar in the urine. If present, is a sign of diabetes or gestational diabetes. So while I like the glucose test, or what I want to say more on the glucose test, you just don't take one sample and say, yes, they have diabetes. It might be they just ate something very high in sugar, or it's something that's going on, because stress can also raise your blood sugar. Next slide. And leukocyte X-ray urine test present in most white blood cells. Positive may indicate inflammation in the urinary tract or kidneys. Most common cause of white blood cell in urine, bacterial urinary tract infection. And also specific gravity test shows the concentration of all chemical particles in your urine. Abnormal tests may indicate several different health conditions. Next slide. The specific gravity really compares the density of urine with density of water. That you can tell from dehydration how much concentration of density of water is in the urine, and also you can get results. I mean, it can lead you to diagnosis of heart failure, shock, diabetes insipidus, which is the water diabetes, kidney failure, kidney infection, UTI, hyponatremia, or low sodium levels. Next slide. Okay, urine pH measures the acid base level in your urine. High urine pH may indicate kidney issues and urinary tract infections. Low urine pH indicates conditions including diabetes and diarrhea and ketoacidosis. Next slide. This is just a picture of normal crystals, which are substances that you find in urine, and which is uric acid, calcium oxalate, calcium phosphate, triple phosphate, and all that. And all crystals, leucines, and acyclovir and indonavir. Next slide. This is just another continuation of normal crystals in urine. Urinalysis results can have several interpretations due to the variety of tests. Like I said, abnormal results may indicate, but not necessarily guarantee, there's a medical problem. Providers will need further testing, such as blood glucose test or imaging test to diagnose the condition. So just because you did the urine test and you find there's sugar, there's protein, there's bilirubin or whatever it is, does not confirm that there's something. You have to further it up to other tests. And this is very important for children. You have a child come to the clinic, present with fever. You don't know what the mother says, but it just has. I don't know what's happening. Do a urinalysis on them, condition. Like I said, you do the urine dipstick, look at what you find, send it out, then confirm a diagnosis. Results can provide helpful insights and helpful points and help point providers in the right direction towards the diagnosis. That's right. You also send for cultural sensitivity for positive findings. You see positive protein, positive glucose, whatever it is, send it out, confirm your diagnosis before you say, this is what's going on. Next slide. When should I call my doctor? We know ourselves, you know how you feel, you smell urine, you smell your urine and you smell, you smell a bad odor. You see a color that you know this is not my normal color. And you go to the bathroom more often, you have itching, you have whatever it is. You don't, nobody knows yourself than, nobody knows you than yourself. So when you experience anything unusual, call your doctor. And I will give credit to the people where I got my information from. And next slide. If you have any questions. I told you it's nothing.
Do anyone have questions?
Madam Deputy Minister.
Well, I shouldn't say it's a question, I just want to commend Madam Kadibala Diallo. Thank you, thank you, thank you. I believe this is a much needed information for Sierra Leoneans talking about urinalysis. Because this is something that we do see on a daily basis. We're going to the public bathrooms, restrooms, and you can just see somebody that just came out of the bathroom. The color of the urine is very, very dark. And I believe what you've done today will give us the knowledge that is needed. So anything that comes out of our body, especially with the urine, we should be asking ourselves, is this the normal color of the urine? Without you not taking any medication. Should my urine have this odor, very offensive odor? What are the consistency of the urine? Should we have all this foamy thing that looks, that comes with the urine? And something very important to the amount of the urine. Too little, too much could be a diagnosis. Too much could be the beginning of diabetes. Polyuria. Too little, you should be asking, if my urine is not coming out, where is it going to? Okay, and when is it going there? It could be in the bladder. Now you're having a bladder infection. And from the bladder, it keeps ascending to the urethra. Before you know it, you end up having a renal failure, chronic renal failure. Now, even in children, in Sierra Leone, we've seen the increase in renal diseases. So let's make this a must to assess ourselves, to assess the urine, so that we can prevent anything from us having renal diseases. Female, by the way, don't forget, when you wash, when you wipe from front to back, not back to front. Because our urethra is much shorter. If you wipe from back to front, you're gonna introduce pathogens into the urethra. And here, by the way, we have a longer urethra. When you add UTI, means you have it for so long. So what is the game plan? Before and after sexual intercourse, empty your bladder. Thank you. She is the Deputy Minister of Trade, but she is also, she is in America. So she speaks with authority. Thank you, sir.
17 years.
Thank you for your masterpiece presentation. My question is whether we can link bedwet with urinalysis. Bedwetting.
Bedwetting is not related, cannot be linked to urinalysis. Is that your question? Yes. I don't see any connection with bedwetting and urinalysis.
Then in a sense, and it ends them within the society.
Or UTI. Did you want to say something?
We can't hear.
Josephine, mic over there.
All right. Dr. Yubuka, thank you very much for such an exceptional organization. It's a topic that's so important for our ministers are alluded to. I just want to add that there is actually an association between the discrimination and yeah. And so what happens is that, especially in children, this is very important. But normally, like bedwetting in kids before the age of 5, we say it's not pathological. However, though, after the age of 5, a child has just been. We have what we call vesico-urethral reflux. Because there's an anatomical problem that happens usually during genetically during birth. This child has, and then when they present is this bedwet. So that's very, very important. So a child that's just come with incontinence, we have to check. Most of the time we do ultrasound and we'll be able to figure out this disease. Thank you. Thank you.
So guys, you,
One more question.
I thought we said 2 questions. I'm hungry.
Just a quick question. The difference between UTI and just regular infection.
Say what again?
The difference between UTI and just regular.
UTI, urinary tract infection, is the same thing as infection coming from the urinary tract. Other body infection has nothing to do with urinary tract infection. Urinary tract infection is infection in the urinary tract, meaning the bladder, urethra, and caused by, like the minister said, for women, you wipe yourself front to back and not back to front, not to introduce bacteria in you. For men, clean yourself right. I know during school time they talk about men who are not circumcised. You have to clean yourself well because the tissue hanging accumulates bacteria. So you don't clean yourself right, you get infection from that. The circumcised men, you're good. But definitely, and also sexual activity. Multiple sex partners, you don't know who's gone to who, and then if you get to that person, you can get infection, especially STD. So you have to be very careful. You want to jump around with condoms.
Thank you,
Yes.
thank you for your presentation. I think one of the most important aspects of the analysis test is that it is simple to do and very easy to learn. For us nephrologists, there's no way we can practice without the test is about.
Can you hear in the back? Okay.
Yeah, for us nephrologists, there's not much in terms of practice without urinalysis because it tells us so much. It is akin to like the liquid biopsy. So you can tell about infection, as you say, tell about kidney disease, different aspects of it. So it's useful and we're grateful that you've been able to highlight that here. Thank you.
Thank you, thank you. So we are at the end of this symposium. We now have the closing remarks. And before that, any of the medical people that need any of the slides or presentation, you could contact any of the membership of Healthcare Sterling. We'll be able to email those presentations to you.
Dr. Sharif, I'm going to put them all together into a book.
Dr. Sharana.
Okay.
I will now introduce Madam Peter Kanachende for the closing remarks. Thank you. Guys, give her a big warm applause.
Good afternoon, ladies and gentlemen. Thank you. 70% of the book says through the whole program. We dearly appreciate your time. My big thank you to our keynote speaker, Deputy Minister of Health and Deputy Minister of Trade. Thank you for gracing us with your presence. We definitely appreciate it. I'm going to make this very brief. I was going to comment on every presenter, but I'm not, because we're all hungry. Ladies and gentlemen of the healthcare Leone team, you guys did a fantastic job. I think the only thing missing with this, maybe next time we need to give CMEs for all the presentations we're doing. So some of us can get paid or use our work money to come to work and do it. I'm not going to hold you further. A big thank you to Leone team, a big thank you to the media team, a big thank you to our members that put this stuff together. It took a lot of planning, a lot of phone calls, but it came out wonderful. And a big thank you to all the people that started to follow the program. We appreciate you, and we'll see you again next year. Thank you. It's lunchtime.
Wait 1 minute, guys. Before, let's have it all the way in respect to the way we'll go upstairs where the food is. It's at the restaurant level upstairs. You get out of the elevator, the stairs, you make a left. So I want it to be more all the way. So the first table here on my left will be the first to start going upstairs. Then after the second table and the next table, so we don't crowd the stairs. So
Yeah, we thank the people out there on Zoom. If you're on Zoom, we're closing out. But please remember, if you're in the Mayambabo, we have our outreach teams going, they're gonna be in Mayamba.
correct.
And Bura Town,
So we're gonna be in one site tomorrow, the 20th, 22nd, and 23rd. And we come back to the peninsular western area suburb where we're gonna be at Kent and Brewett on the 23rd and 4th.
consultation and medications are free. So tell your people to be there, to come around, please. Everything is free.
Let's set table 1 over there, please. Let's set one upstairs. There's food prepared, food is ready for us. And this table, let's set one upstairs as well. And the
Just wanted to say goodbye to everybody. Thank
Thank
you.
Thank
Thank
you.
you. You guys gonna mute and say hi, those in the Zoom.
Right.
Thank you, everyone online. Thank you.
Hi, thank you for joining.
Thank you.